everybody, and welcome back to another episode of Hybrid Healing Hour. Today, Dr. Marias is out of the office, and we are going to have another special guest on our show today, Jessie Bornstein. She is a Pilates instructor, and we are going to discuss Pilates, all about it.
Yay.
So go ahead and tell us, Jessie, a little bit about yourself, your background, and how did you get to where you are today?
Okay, so I grew up dancing pretty much my whole life. Like, I think I was 2.5 when my mom stuck me in a dance class. So I did that pretty much my whole life. And then I decided to go to college for exercise. I knew I wanted to do something with movement. Right. I just didn't know exactly what. So I studied exercise science in college, and somewhere along the line in college, I wanted to work at like a gym, or I was pretty open. I just wanted to work somewhere that, like a gym or anything, a studio, whatever.
You loved physical fitness, exercise, promoting health and wellness, right?
Exactly. So I applied a couple places, and a place called Club Pilates called me back, and it was like the first place to offer me a job, and I said yes. And before that, actually, I had barely any exposure to Pilates. I think during my dance career, maybe once I took a mat Pilates class, and then in college for an elective, I took a mat Pilates class, and that teacher actually took us to her studio. She owned a private studio, and that was like my first ever time working on, I'll explain it later, but what we call the reformer, and I kind of immediately fell in love with it. So when I got this job, I was like, oh my God, this is great. I can take free Pilates classes. I already knew I kind of liked it, but I just worked at the front desk, and I was in college still. And then they were doing a teacher training, and I was like, you know what, kind of just makes sense to do this now. So I did that. And then by the time I graduated college, I was certified. It was like a 500-hour comprehensive certification. So I was doing it was like a year. It took me a year, because you have to do observation hours and practice teaching hours. And there's an online portion. It was a lot. But I had a job when I graduated. My owner hired me right away as a Pilates instructor, and I've been doing that for 6 years now. I was 19 when I started.
Awesome.
Yeah.
And you love it.
I love it. It's the best.
I can't wait to learn more about it, because I have always been physically active, but I am more so a gym person.
Got you.
And so I'm not flexible, and I am dying to learn how this can benefit people. And let's dive right in.
Okay.
So tell me a little bit about the history of Pilates.
Okay. So a lot of people actually don't know this, but it was created by Joseph Pilates. I'm sure you maybe looked into it a little bit.
I did, yes.
So this man named Joseph Pilates, he was born, I looked it up, 1833 in Germany.
Yes.
And his mom was a naturopath, and his dad was a gymnast. So he grew up in a health conscious household, and he was also a very sick child. I think he had rickets, which I don't even really know what that means, and asthma. He had all these different ailments. So it was said that he was super determined to just live a healthy lifestyle and beat all of those little ailments. So he was very athletic. He did a bunch of different sports. And when he was a young man, I think he was drafted. I don't really know a lot about history, but he was drafted by the German military and stationed in England, where he started teaching group fitness type classes. And I think he started to just kind of evolve what we know now as Pilates. After he did that, he moved back to Germany, met his wife, Clara, who's very important in the Pilates lineage. And they moved to New York and started and opened their first studio. But at the time, he called it Contrology. We call it Pilates. We only call it Pilates after he passed away.
Okay.
Yeah.
With
but
his
it was
name.
called, yes.
Okay.
It was called Contrology, and it was very exclusive. He only did lessons with professional dancers, gymnasts, circus performers. It was very exclusive, celebrities, which is kind of coming back to that now, which is interesting. But anyway, so the regular person wasn't ever exposed to it. I'll just let that go.
Yeah.
Thank you. And yeah, that's kind of where it started. He also only taught a few people how to teach Pilates. And those people taught a few more people. So there's kind of a Pilates lineage. And now it's a lot different. But back in the day, you had to learn underneath someone who directly learned from him how to teach it. Now it's different, but
Right.
yeah.
Oh, wow. So it was very exclusive.
Very exclusive.
Okay.
Mhm. Yeah.
So it's actually been around for a lot longer than people think.
Yes.
Okay.
A very long time. Yeah.
So what kind of workout is Pilates?
Yes.
How would you describe it?
Well, I'll explain in my own words, but I'm going to read a quote by him. This is how he explained it.
Mm-hmm.
He said, the Pilates method of body conditioning develops the body uniformly, corrects posture, restores vitality, invigorates the mind, and elevates the spirit.
So I hear a lot of like mind and body connection.
Yes.
And so that,
his whole thing was like he wanted a whole body experience that like trickled into your day-to-day life, which it really does. I always explain it to people as we focus on, I call it the baby body, like all the little baby muscles underneath the bigger muscles that help, like all the little stabilizers, all your little abdominal support muscles. Mm-hmm. That's really what we're focused on. And it's like a lot of like spine movements. Like we try to move the spine in every direction, flexion, extension, lateral flexion, rotation. It's like really like a whole body experience.
Is there a lot of repetitive movements?
Not really.
Okay.
I hear what you like repetitive.
Or does it depend on the type of Pilates you do?
Yes. And also I wanted to mention Joseph Pilates was also like very inventive. I'm sure you've heard, I teach reformer Pilates. Mm-hmm. The reformer is like his main piece of equipment. He like allegedly, when he was in the military, he saw his fellow, I don't know what to call them, military men in hospital beds on their backs. And he attached springs to the headboard and the footboard so they could get some kind of movement in. And that was like his first idea of the reformer.
Right.
But it kind of evolved over time. You can think of it like a bed. You lay on it like a bed. There's like a headrest and there's shoulder supports so you don't slide up. And it works against spring tension, gravity, and your body weight. And there's dozens of different moves. That's another thing is what he taught is called classical Pilates. It's pretty much choreography. So it's the same exact flow every time.
Okay.
And there was no modifications. If you couldn't do a movement, you just skip it. Now it's evolved into, it's called contemporary Pilates, which is what I teach, where we offer modifications, progressions, and a lot of the movements are inspired by the classical choreography, but it's just evolved. But there are still a lot of people who only teach classical, like the classical choreography, and a lot of people love it, and it's super beneficial and amazing. But it is adapting. Like it is.
Is classical the one that you talk about a lot with the spine and the core and the abs and twisting?
Both are.
Both are.
Both.
Okay.
Yeah, both.
Okay.
The difference is just like it's the same exact flow every single time. Whereas what I teach, there's just more room for
variety.
Yeah. Okay. Exactly. Yeah.
Gotcha. Mm-hmm. And is Pilates considered like low intensity versus high intensity, or is it different types?
Low impact. You build muscle through time under tension, but you're not creating progressive overload of your muscles. So I always say you're creating long, lean muscles. You're not like bulking or creating muscle mass. So I always recommend people do strength training with Pilates.
I love to hear that.
Yes. I don't think it's like a one-stop shop.
Thank you for clarifying that. Yeah. I was going to actually ask that later in I heard that Pilates was great for more like the endurance, and because we have two different muscle types, and there's endurance muscles and then there's the
type 1, type 2, the fast twitch, slow twitch. Yeah.
Exactly. Yeah. And, a lot of people out there, I think particularly women, are afraid of bulking. And so I think that's kind of a misnomer that if you do Pilates, you will be lean. But here's the thing, and you're going to be strong. I don't doubt that. But I think you still need to build muscle, especially as we get older. Mm-hmm. We are less likely to maintain that muscle mass.
Mm-hmm. Absolutely agree.
Okay. Yeah. Fabulous.
Absolutely agree.
And would you say, you said, so it's low impact, you said, but intensity wise, is it like spin class to me it's super intense, high intensity. You're in that, I always say the parasympathetic or sympathetic mode, the fight or flight that we call. So to me, spin is you're in fight mode for an hour straight. But what about Pilates?
The studio I teach at, we do it by levels.
Okay.
So there's 1.5 to 2.5.
Which is kind of like a beginner.
Beginner. It is designed for just someone who honestly has never moved in their life, like can come in, take a level 1 class and feel somewhat confident. But I would say it ranges. Like it can be super chill, and then it also can be super intense. I would never say that you're hitting your like max heart rate or anything like that. You're gonna leave sweating, but you're not gonna leave like dying sweating, like feel.
Okay.
But you are going to feel, because it's all working all the little baby muscles. So you feel shaky.
Like a twitching.
Yeah.
Almost. Yeah.
Yes.
Okay. Wonderful.
Mm-hmm.
Now, can you explain, I guess you kind of already have, but let me know if there's any other input you have on the difference between like Pilates and yoga or bar, because bar is out there too, where people like to do that lean muscle lengthening.
Bars and yoga, it's all body weight. Essentially, right? Because I mean, in yoga is like all the Western philosophy. It's like a deeper practice, whereas Pilates, although you are working like the mind-body connection, there's no like deep philosophical roots.
Okay,
but like movement-wise, we're working against spring tension. We're working with a bunch of pieces of equipment, not just the reformer. We work with something called the Wunda chair, which is like a little chair-looking thing that also works on spring tension. We have a springboard where we do like your classic like rowing, bicep curls.
Okay.
So you are doing
some resistance.
Oh yeah, you're doing yes.
Okay. So I'm a big fan of like, even if you can't lift weights, I like resistance bands.
Yeah, it's like that.
Like booty bands, things like that. So you're at least doing that pushing or pulling motion.
Exactly.
Okay, wonderful. And so you already kind of described that the reformer is a machine, or I guess not a machine, but
it is kind of
a machine. Okay.
Kind of.
And that's used. So, but I've also heard like Pilates reformer is a class.
Yes.
Okay.
Well, yes.
So is there any other like terminology like that people would hear, or any other different types of, you mentioned like classical versus contemporary, because like yoga has many different types of yoga, right? I mean, hot yoga, vinyasa, like, and what about Pilates?
So a lot of people just like a lot of Pilates instructors only do private training, like one-on-one, which is kind of how Joseph Pilates did it. It was never like a big group class, whereas now it's become kind of more of like a group fitness situation. The studio I teach for, we have 12 reformers, so it can be up to 12 people a class. We also do privates, but there's a lot of terminology. I always explain it like ballet. Like you have to kind of learn it from the basics, because there's like different, like neutral spine, for example. This is like more movement. Sure. I don't know if this is what you were speaking of, but can you ask the question again?
Yeah. So, and I was actually going to get into like the terminology later, but we can. It's more like the classes, the different types. Okay, like, you know, even when you go to the gym, they have many different types of classes. So you have to know like, well, what's this class involve? Right. So, so
the Club Pilates way, I have only taught there. It does it through the levels, and there's different types of classes. Actually, we do, you know, the TRX, we do TRX classes, but every class you'll use, at least you'll be half on the reformer and half supplementing with something else. But if you were just to like call a Pilates studio, I would just ask for their most, if it was your first time, just ask what their most like basic beginner class is, and then work your way up from there. But yeah, it is kind of intimidating, because it's like a bunch of new, like you're like, what is a reformer? And it looks crazy. You're like, what is this contraption? But it's actually, once you're on it, you're like, oh, this is it's kind of intuitive, and it just makes sense. I don't know. It's not as intimidating as it would seem.
Right.
You know,
because
like the gym is intimidating.
And I get that. And so to me, it's not, but I always tell people, I'm like, just go and say, today I'm going to go and I'm going to do 3 different machines, and I'm going to just take my time. I'm going to sit there, and I don't care if I look stupid or not. Right.
Yeah,
that's like, I'm intimidated to even do yoga, because I am not flexible. And so I'm also intimidated to do Pilates. I'm not going to lie. And so when I get on social media, they show all these like crazy moves. And I'm like, oh my God.
Don't base it off of that.
Right.
Yeah.
And so I was actually listening to another instructor speak, and she was saying that this is just, people are doing crazy moves on these machines. That is not how it really is in the studio, and to not be afraid. And I thought that was a great tip.
Yeah. They're just, I mean, a lot of it is trying to get clicks and likes.
That's
and
exactly, like,
make it like beautiful and amazing. And like, it's just not realistic to what we actually do. I mean, we can take it there, but a lot of the time, especially in a group setting, a lot of those moves are unsafe.
Right.
Like I was going to touch on like how Club Pilates teaches and their like flow structure.
Go ahead.
Okay.
Yeah. I'm interested to hear that.
So I did my training through Club Pilates, which and I've done like continuing education courses and stuff, but I would like to do a different training as well. Not to say anything bad about the Club Pilates training, but I just would like more of like a classical. I don't have like a classical background. I have more of a contemporary background. But the way we teach pretty much, and they're everywhere. Like you've probably seen Club Pilates everywhere.
It's a chain.
It's a chain. They're all over the country. So if you go to a Club Pilates studio, you kind of know what you can, like what to expect, because they're all teach pretty similarly. We start with something called footwork. You can think of it like squats. Okay. You're laying down on the reformer bed. So it takes a lot of like the pressure off of your joints. But being on your back and working against the tension, you can like correct movement patterns. And another thing I wanted to mention is a lot of what we do is all focused around, we call it the powerhouse, which is like your abdominals, your hips, your glutes, your lower back. So even if we're moving the limbs, like we're always focused on the powerhouse, like stabilizing that area first.
Sure.
Engaging your core, squeezing your glutes. And also like a lot of like we do a lot of pelvic floor stuff.
Which I love, because that's
amazing.
That's very important in our practice. Yes. And especially for women.
Yes.
And it's great for men too. So this is not just for women. I want to put that out there.
It was created by a man for men.
Exactly. And military men. Let's say that, like.
Yeah. And the women, we kind of stole it, which we deserve it. But I love when men come to class and I love when men fall in love with it, because it's like, it's so good. It's so good for everybody. But anyway, so we start with the footwork, which is again, like squats, except you're working against resistance. We always do some kind of bridging, which is, bridging.
Lifting your pelvic floor. Lifting your like butt up in the air, which is phenomenal for pelvic floor strengthening.
Yes. And strengthening your spine, stretching your hip flexors, the front of your body. We always do some kind of planking. Okay, which is full body.
Which I love planks, and I always tell people I never do ab exercises, but I do core exercises. Yes. What I love hearing from you is saying the powerhouse is going to work your front and your back all around. Yes, it's 360 crunches are just doing your abs.
Yeah, no,
and you have to strengthen all around the trunk.
Exactly.
Okay.
And we tried to move the spine in every direction, like I was saying earlier.
Twisting.
Yeah, we do a lot of extension, which improves your posture. We do a lot of like range of motion stuff, like a lot of, like clamshells against resistance, stuff like that.
Which most people do not stretch enough. And so it's very alleviating from pain. In fact, I was actually just speaking with a patient today, and she mentioned going to Pilates. And I was like, oh, I'm actually doing a podcast on that today. And she was saying, the one thing I will say is my husband and I have been doing Pilates for over a year. We used to have back pain and it is gone. We love Pilates for that reason. Our core is so much stronger. And, that's one of the biggest things we love in our office is core strengthening support to help with balance and stability. So this is music to my ears.
Yeah, no, it's amazing. And I recommend it for runners, CrossFit people, even me. I grew up dancing and I have issues now because I didn't have the strength. Like it was a lot of flexibility at a young age. Like your body is growing when you're a young person. And I didn't have the strength to support the flexibility. So now that I know Pilates, I'm like, wow, I wish I had that and I have friends who teach young dancers Pilates, which is amazing. But yeah, we build all those little baby muscles that support whatever it is that you do, like it helps in every area of your life. Like even if you're sitting at a desk all day, like you'll just be more conscious. You'll sit up taller. You'll engage your core.
It's great for posture.
Great for posture. And just like people say, I mean, this is the goal, but people leave and they're like, I just feel so much better. It's like
I
a
love
weight
it.
off your shoulders.
Well, and to me, that means there is some mind and body connection.
Oh, yeah.
So it might be a different
Mm-hmm.
way than the deeper theory behind yoga,
Yes.
right? But when you can alleviate the stress on your body
Yes.
and you can feel good, obviously there's some endorphins being released and whatnot.
Yep.
I think it's definitely helping. And one, I'm going to go back to the whole parasympathetic and sympathetic system, because this is more of a low intensity exercise. You're going to sweat. I'm not saying this is not good enough, but
Right.
especially as we get older, it has been known that women should avoid doing these high intensity, stressful workouts because our cortisol levels are through the roof.
Right.
And we need to get that down. And how do you do that? It's by relaxation or low intensity exercises. And especially for menstruating females during the progesterone phase, so like days 20 until the first day of their cycle, low intensity exercise like Pilates, yoga, and walking are phenomenal for that phase.
Yeah.
And I highly recommend it.
Cannot agree more.
Yay. So, I guess, do you actually build muscle with Pilates? Because you mentioned like you get the little small twitches, you're getting a good workout.
Right.
Do you get hypertrophy of the muscle?
From what I have, especially like 6 years later, I think you build, I don't know. No.
Okay.
You're not creating progressive overload of your muscles. So you're not creating hypertrophy, but you are strengthening all of your deep core. And again, all those little baby stabilizer muscles. And we do work under, I think maybe a little bit, but again, I think you should, I think especially women should do strength training with the Pilates. I don't think but we do use hand weights.
Okay.
And a lot of studios are starting to make like more athletic Pilates, reformer Pilates, where they're using, the booty bands and the hand weights and like, I use it's called the magic circle, which is
it's where like you have to do that's like an isometrics where you're putting pressure and I think that's really good for your core and you're like squeezing right to hold it straight.
I think you do create muscle. I just don't think I don't think everyone should just go to Pilates and expect all their dreams to come true, health dreams to come true.
I cannot agree more with that. So I think when people are seeing this on social media, like, I just dropped 20 pounds with going to Pilates and now I'm toned.
Have you seen that?
Yes, of course. But have I seen it in real life? No.
Yeah, no.
It doesn't happen like that. And that's what I think people have to understand. There's still 80% of this is diet related.
Yes.
You have to, like most people who are going to Pilates are also watching what they eat. And they're also very health conscious. Right. I think when you're expecting this to be the be all end all, end all be all, like it's probably not. And like you said, if you want to get stronger, you probably need to incorporate some weight training as well. But I think Pilates has a lot of benefits in the fact of creating that stability, the endurance of your muscles and flexibility, and also just alleviating that stress on your body and helping with the posture and the pain.
Yes.
Yeah.
And a lot of physios, physical therapists use the reformer actually to help rehab, whatever it may be, like ankle injuries, knee injuries, hip replacement, knee replacement. It's very like rehabilitative, and people do say they like feel like if they have lower back pain in 10 classes, they say they feel like a different person. I
like the idea of what you said earlier when you're laying on it horizontally and you can do a leg press, right? Yes. And you're doing it with spring resistance, but not necessarily weight, right? So when I have people who I really want them to work on building their legs, like their leg muscles, and they have bilateral osteoarthritis of their knees or knee replacements or hip issues or range of motion limitations. I think that's a great option for them, and they can work on that posture and like the correct form. And having a small class size, it sounds like the instructors are able to come around and really hone in on that.
Back and forth,
Wonderful.
Checking on everyone. I'm not doing the exercise with them, which is also different than yoga. Usually your yoga instructor is doing the flow with you. I'm cueing. It's all verbal cues, and I'm making sure everybody's
check posture.
Exactly.
Because I'm a bigger fan of like things like that rather than I like quality, not quantity.
Yes.
Perfect.
And I want to mention too, sometimes I think everyone can do Pilates. Like if you have any contraindicate, like there's nothing really that would say, no, you cannot do Pilates. But I always recommend privates, especially to the older population first.
Like a private session?
A private session. And a lot of Pilates studios actually make that a requirement. They have to do like a couple privates just so they feel comfortable in a group setting, because it is a lot of new terminology. It's a lot. It's new. It's completely new. So I think if anyone's a little bit like weary or nervous, I think just do a private and ask to learn the basics and the basic terminology and do it that way so you feel comfortable. Even pregnant people, I have like 4 pregnant women right now that are in my classes, and it's just the best.
It sounds like
it's the best.
Quote unquote safe.
It is safe. It is very safe. If it's taught by a good instructor, it's very safe. I think,
Nice.
Yeah.
And so tell me, I mean, we talked about all the different benefits. And some of that is getting a better range of motion. So do you have to be flexible before you go?
No.
Okay.
No, it's like anything flexible. You say you're not flexible, but if you practice just like you do weightlifting,
it's going to get better.
You would become more and more flexible. We also do a lot of coordination stuff, which helps, your brain and but no, you definitely do not have to be flexible to do it. It all actually makes the reformer all of the flexibility stuff a little bit easier. You can think of it, the pull-up machine where the more weight you add, the more assistance you have.
Yes.
It's kind of like that. So like the resistance is almost supporting your muscles and your body in a way that helps you, again, like safely do it.
To where you can only move to where you can move. Like you're not going to move past and get stuck and be like hurting.
Well, you could.
Okay.
But this is like very technical, but like the more, let's say we do something called feet and straps, and you're laying on your back and there's loops behind you, put the loops on your feet, and we do like hip circles.
Oh, yes.
So the less resistance you have, the more challenging it becomes, because it's
relying on your core.
Yes.
Yeah.
Whereas like the more weight you add, the more supportive it feels. So there's always ways to like progress and modify the movements. But you definitely do not have to be like super duper flexible. You don't have to be dancer, like in your splits. No. And it's like, flexibility is so important, even for like weight training. Like it is. It's
very important. A lot of people don't realize the hips are very important for range of motion. And I do hip strengthening exercises and stretching for that reason, to be able to get a better quality in my lifting, like with squats and hip, like you said, bridges, like that. You're going to have a better progression if you have better mobility.
Yeah.
Fabulous. So why would somebody choose Pilates over any other workout?
I think I think the group atmosphere is really and the reformer, people fall in love with the reformer, is really like what keeps people going back, because you create like a little community. And I found that everybody is very accepting. I have 80-year-old people that come to my classes, and I have early 20s. I actually have like a 14-year-old girl that comes. Like it's such a big range of people that people tend to feel very comfortable. It's not like what's the word?
It's not cliquey?
It's not cliquey. It's not like vain. Like you don't feel insecure like people. And you're also kind of like laying down for a lot of the workout. So you're not really worried about anybody else. Nobody's looking at you. So it's like a really good, if you haven't moved in a long time, I always say like this is like a really good way to kind of get back into it, because it's safe, it's low impact, and it like feels safe, like in your heart and your like mind, like it's not like an intimidating environment. But it also, again, like trickles into your day-to-day life. Like it improves your posture, it improves your flexibility, it improves like your mental well-being. It's like a very well-rounded practice. And it's fun. It's fun. Every class I teach is different. Like I don't think I've ever taught the same class twice. It keeps it interesting. It keeps it challenging. It keeps your mind working. Like it's just fun. It's like really fun.
Tell us, what would somebody expect then for a typical class? Like, is there music? Tell us like what that would entail.
Every instructor can kind of like set their own vibe. I love music. That's kind of like my thing. I make my own playlists. I'm very picky. So I have my music playing. It's not like insane music, but it just like keeps the flow going. I'm very into like, since I have the dance background, like I like to choreograph the 50-minute classes, by the way, too.
Okay.
And it goes by like that. Mm-hmm. And if it doesn't go by like that, you probably should find a different instructor.
Okay.
But like some people are like counting down the minutes, not in my classes, hopefully, but like it should feel like it goes by so quick because you're moving from the reformer to the chair to the springboard and you're using the box and it just constantly flowing. You never stop. You're never like, okay, stop, take a break.
Well, and I think
you're constantly moving.
The fact that you said you're not dying.
Yeah,
so you're not like panting saying, oh my God, I hate my life. Why am I here?
You're not like seeing stars and
Right. Mm-hmm. Okay. Yeah. So it's 50 minutes.
50 minutes. Well, my classes at Club Pilates, they're all 50 minutes.
That's what I saw like the average was.
Yes. Okay. Yeah, 45 to 50 minutes. That's really all you need. And then there's also mat Pilates, which over COVID, I actually taught a lot of like Zoom mat Pilates classes. And I always tell people it's more challenging, again, because you don't have the support of the reformer. Mm-hmm. Challenging in a different way. But that's also, there's a lot of mat Pilates classes. Just be mindful. There's like hot Pilates classes now. I don't know how I feel about that.
Okay.
There's like a lot of different
people like to do a lot of things
emerging.
Sweating. Yes. Anything to make people sweat more.
Yes. Yeah. People love that.
Yeah. Okay. So there's mat Pilates, like hot Pilates. You said there's a classic.
There's classical.
The contemporary.
And most places you go to nowadays will be more of like a contemporary style.
Where they incorporate a bunch of different things, like different varieties.
And progressions and modifications. Like every class, even if you're a very advanced student and you come to my like level 1 class, maybe just that time works for you. Like I always offer progressions. And then same thing if like a time that works for you and it's a more advanced class. Some classes you need permission, but like, let's say you book a 1.5 and you're level 1, like I'll offer modification. So everything is modifiable. It's like really non-intimidating. I think it just seems really scary to people because they're like, oh, I'm not flexible. I don't know. What is this machine? But we also do the free intro classes at Club Pilates at least, where it's 30 minutes. It's like very introductory. We teach you how to use the equipment, where the straps are, where the foot bar is, like all the things you need to know, how to get your feet in the loops.
That's good.
To like set you up for success in your first class. So it's a good structure. I really like the way that Club Pilates has made it like available for everyone, like just your average Joe.
I like that.
Walk in and do it.
Yeah, that definitely helps make it less intimidating. Mm-hmm. Are there any cons, would you say? No. Not like contraindications, but like anything negatives towards Pilates?
I wouldn't say towards Pilates that I teach. I think there's a different kind of Pilates called, well, it's not Pilates. Okay. I don't want to get in trouble here either because it's kind of like there's a feud between people who teach, it's called Legree, and Pilates. Not a feud, but they're two very different things. So if you see, should I call out specific names? Because I think a lot of people know like solid core. They use something called a mega reformer, which is inspired by Joseph Pilates' reformer by a man named Legree. And that's more strength training. So that's completely different from, they focus on like progressive overload, which you may want to, I think, try everything and like see what works for you. But it's very different from what I teach. And I think a lot of those studios, even some of them aren't actually Legree. They just use the mega reformer and they call it Pilates, but it's completely different. So I think just be mindful of that.
So wherever somebody wants to go experiment with Pilates, and if they're a beginner, they want to make sure that they're using a reformer and not a mega reformer.
Yes, unless you're interested in trying that too. But don't
go once you're familiar with the regular.
It's a completely different workout.
Okay.
But a lot of places do call it Pilates, so some people may get confused. And the Legree studios I know don't do like levels, so it's kind of intense, like right off the bat. So I would maybe just ask, like if you do see just ask the questions, like, is this like contemporary Pilates or is this Legree? Like maybe just ask the question. Yeah.
And then they would have to tell you.
Yeah.
Much. Okay. Yeah. Yes. All right. Thanks for that input because I have never even heard of that.
Okay. Yeah. So there's a lot of studios popping up, especially in Boca, where it's like they're teaching like Legree type of Pilates and they're calling it Pilates and it's just not Pilates.
It's not the same.
Okay.
No. More intense.
It's more intense. Yes. It's just completely different. Like it's a completely different workout.
So I want to go ahead and touch on, say I'm going to go to a class. What do I wear? What do I need to bring?
Grip socks is like the most important thing, which we sell them at the studio, or you can, order them online.
Are they the same ones that some people get when they're in the hospital?
Don't use those ones.
Okay.
Those grips aren't really good.
Okay.
You want like really grippy socks so you don't slip.
And probably like tight form, like
fitted socks, not like loose. Yeah.
Right.
I think the intro class, we let people use like hospital socks if that's all they have. But yeah, grip socks, just something comfortable. It's hard because you're like laying down. So my like ladies with long hair, you kind of have to figure out a hairstyle that works. Cause like I always do the bun and it like pushes into the headrest and it doesn't feel good. So I always have to make like a low pony. But that's
braid, maybe.
Yeah, you even hair down, but you just have to make, if you have long hair, maybe not, because it can get stuck in the springs. Just something comfortable, just like normal athletic wear.
Would you recommend tight clothing though? Because you're moving. Okay. So not like loose baggy pants?
No, I would say like,
tight,
but like my men wear
like shorts, gym shorts are fine.
Yeah, like
with like tights underneath probably. So
I would say like don't wear like a super loose shirt maybe because you're
laying on top of the reformer.
Yeah.
Okay.
But
and it has
really
to be able to
not
move.
that. Yeah. It's really not that like strict about dress code or anything.
Okay. Awesome. What else can you inform our audience about?
That's a good question.
Anything else that we forgot?
I think we hit everything. I don't know. Let me see.
Wonderful.
Yeah, I don't know. I can't think of anything else.
Wonderful. So tell them, how can they reach you?
So should I give my Instagram? Well, I don't really post that much Pilates content on my Instagram. It's mostly my daughter.
Okay.
But if you're interested in taking a Pilates class, I would say if you want to try Club Pilates, I think if you're like brand new to Pilates, that might be the route because we what's the word?
I think you
format it for like at the very beginner level. I would say just look up your closest Club Pilates, go on their website, and I think you can book the intro class on their website, or you can just call and they'll book it for you. And take the intro class. And once you take the intro, they give you all the information about memberships and class schedule and class formats and all of that. I think try it. I think you should try it.
I know. I'm excited. I will try it.
Come to my class.
I will.
Well, there's actually one right here.
Okay.
Yeah.
Well, thank you, Jessie.
You're
this was
welcome.
wonderful. I hope everyone out there has learned a lot about Pilates just like I have. And I hope everyone goes and gives it a try.
Yes, give it a try. Thank you.
Mm-hmm.
The information contained in this podcast is provided for informational and educational purposes only and is not intended for the purposes of diagnosing, curing, treating, or preventing any disease. This podcast is provided on the understanding that it does not constitute medical or other professional advice or services. Before using any products or services referenced on this podcast, consult with your healthcare provider, carefully read all labels, and heed all directions and cautions that accompany the products. Information found or received through the podcast should not be used in place of a consultation or advice from a healthcare provider. If you suspect you have a medical problem or should you have any healthcare questions, please promptly call or see your healthcare provider. This podcast, including Dr. Brian Marias, Deanna Weilbacher, and Hybrid Medical Solution, do not claim responsibility for any adverse effects from the use of information contained herein. Opinions of guests are their own, and this podcast does not endorse or accept responsibility for any statements made by the guests. This podcast does not make any representations or warranties about guest qualifications or credibility. This podcast may contain paid endorsements and advertisements for products or services. Individuals on this podcast may have a direct or indirect financial interest in products or services referenced.
If you would like to submit any questions or if you have any topics you would be interested in hearing about on future episodes, please contact us through our website, www.hybridmedicalsolution.com. That is solution with no S at the end. Follow us on Instagram and Facebook, all under Hybrid Medical Solution.